Hey guys, want to know what it involves to become an ED doctor in Australia? Watch this video.
Old head. Right? Clinical.
Hello subscribers, how you going? Good to see with you, and sorry it's taken me some time to get back to you with a new video. I was extremely busy with my ED rotation, so I've recently finished off my first 3 months of ED. You remember that I have shared some videos regarding my first few days in the ED, so watch them for different cases I saw. But I thought I'll wrap it up with a whole 3-month overview of what it involved me as a junior doctor, as an international medical graduate, to work in Australia in the ED, and what sort of things I saw, what sort of things I observed. And if you are starting a new job in the ED department, then I can give you a few tips which will essentially help you improve your confidence and your ability to perform better in the ED department. Alright, so essentially this video, I'm going to give you 3 pearls that I feel are the most important things that you need to know. So number 1 is going to be the cases, number 2 is going to be the confidence, and number 3 is going to be collegiality. And these are the 3 things that will get you from an outlier to an integrated part of the hospital system. All right, so let's talk about the first one, cases. Now, in the emergency department, you can get any sort of case. So from surgical, medical, orthopedic, gyne-ops, psychiatric, any sort of case. So essentially what you need to do is be prepared for the most common cases. You obviously cannot have idea on all the cases out there, but as long as you know what are the most common cases and you're really good at that, you can get your ass covered basically. So essentially let's work through them. So the first most common case, and I'm going to talk about 10 common cases and 1 bonus case at the end that I saw during my 3 months in the ED. So number 1 is chest pain. Really common, so you'll get a lot of presentations. Make sure you're good at ECG, at least the basics, so you don't miss out on any ST elevations, don't miss out on any new bundle branch blocks or any sort of other subtle changes such as AF or SVTs or along those lines. So that's number 1, important. Make sure you know that. You also need to make sure you know your ALS algorithm. This is something I didn't really have the grasp of when I initially started, so that's something I'm learning along the way. So your CPRs and all those sort of things. So you need to know that. Number 2, abdominal pain. Really common. A lot of people, young, old, will present with abdominal pain. Can come with a lot of manifestations, but the 2 most common ones in that are cholecystitis/lithiasis and pancreatitis. A lot of people will come to you with pancreatitis, especially if they are mid-50s, 40s, and been consuming a lot of alcohol on a background. That's where you need to sort of think about pancreatitis. Third one, a real common one, is going to be UTI. So UTIs are really common, and make sure you've got a grasp on that. I'm going to give you some sub-classifications in UTIs. So the 4th common one I would say is a renal stone called, so some sort of a renal lithiasis. You need to make sure you've ruled that out, do a CT scan. The 5th one I'd say is more along the lines of an elderly female coming to you with delirium, and generally it's UTI, and you sort of go through that protocol. Essentially with UTIs, make sure you've done your urinalysis, which is like a dipstick, and also sent through a urine MCS before starting any antibiotics. That's really important. All right, number 6 would be alcohol withdrawal syndrome. In Australia, particularly rural areas, especially over the weekends, you see a lot of people doing binge drinking and then coming to you with alcohol withdrawal, some toxicity. So there, generally all the hospitals will have a AWS, alcohol withdrawal scale, and you have to treat the patient accordingly. So make sure you've got a bit of a grasp on that. Number 7 is altered mental control or altered mental health, and that can come in the realms of psychiatric illnesses, and that can present with schizophrenia, paranoid delusions, acute psychosis. And the best way to deal with them is involve a mental health team, and generally all the hospitals will have a mental health team. All you need to do is make sure the patient is vitally stable, Do not over engage in an abusive or an aggressive patient. Just flick them through to the mental health team and let them deal with that. All right. Number 8, surprisingly, this is really common, I've done plenty of these cases, is finger laceration. You will get a lot of people cutting their fingers, particularly on a weekend, and they'll come to you with a cut. So make sure you're good at stitching, you know your suturing techniques, you know, there's just simple interrupted sutures, that's what I do all the time. So make sure you're confident with that and get that sorted out. Then another common one, particularly in elderly people, number 9, this is going to be, make a guess. Remember face? So face is basically stroke. So facial droop, arm sort of weakness, and then basically if you work along those lines, that sort of gives you a picture of stroke / TIA, very common. Make sure you call the code stroke. That's something in Victorian hospitals at least you have to call as a junior medical doctor if you see it. Number 10 is going to be sepsis. So sepsis is really common in Australia, and the other things I've seen, the way people present with sepsis are 2 common conditions. Number 1 is IV drug use. A lot of people will come with fever and whatnot and really unwell, and you figure out they're IV drug users. So that's number 1. Look at the facial appearance, look at the arms, see for any IV drug sort of signs or previous medical records. Other tip is tattoos. Recently infected tattoos are also very common, and people get tattoo infections, anaphylactic sort of reactions. So make sure you work on that. Now, bonus cases, I'm not going to give you 1 case, but 2 cases for bonus, very common presentations in ED, and those are going to be asthma. Asthma is really common, so make sure you know your asthma action plan, print that off, stick it on a wall, give it to the patients. That's what you want to do. And in terms of another bonus presentation, that is going to be pneumonia, particularly in people who have been in the hospital or living in nursing homes. A lot of people will present with pneumonia. Make sure you've got your chest x-rays done, you know how to read the chest x-rays. If you don't, as I did initially, just do a radiopedia course online, or look at a few x-rays, just try to understand what it involves. And those are going to be your cases. So alright, so we've discussed about the first thing, the most common conditions. If you've got a grip on those, I think you'll you'll be good in covering your bases. So make sure you know what you're seeing over there, particularly in terms of the common cases. Number 2 is going to be confidence. Now, in the ED, the most important thing that'll save you as an IMG, as an outsider, is your confidence. If you are not confident, make sure you appear to be confident. Alright. So as soon as people see you unconfident, not being able to problem solve, approach things, not asking questions. So asking questions is also about confidence. Let's say if you don't know something, you go and ask. For example, I saw a spider bite, I didn't know anything about it, I went and asked people. So, you know, you gotta, and if you see a case, make sure you articulate well. So whatever you know, like for example, if a case comes and you've got no idea in that case, some things you can do, right? Number 1, you can check if the patient's vitals, you can do an abdominal examination, you can auscultate the chest, auscultate the heart, have a look at the basic signs and symptoms of the patient, and then do the basic bloods and investigations that you feel normal, like send the patient for a X-ray chest and an X-ray abdomen, for example, and also do some basic bloods on them. So look at their CRP, you look at their white blood count, you get their UCEs with their urea creatinine electrolytes, and then present it to the consultant. Tell them, look, this is the person, this is how it's presented, this is history, these are my findings, my differentials are these, you tell me what to do. All right, that is confidence. If you sort of go over there to the consultant and sort of mumble, they don't like that. So that's number 1. Sorry, that's number 2 actually. Number 1 were the cases. All right. Number 3 is the word called collegiality or fitting in. And that is really important in the Australian system. Now, if you're coming from overseas, it's a really hierarchical sort of a system where consultant sits on top, then you've got the registrars, the residents, and the interns, and the nurses, and the junior nurses. In Australia, it's not like that. It's more of a flat hierarchy, where everybody has their say, everybody can talk to each other. And one of the most powerful people in the hospital, particularly on the floor, are nurses, especially senior nurses. So you got to make sure you have a good sort of understanding with them, because if you don't have a good understanding with them, or you look down upon them, or you sort of are rude to them, that'll make your life worse. All right, so you've got to make sure that you're really good with them, but also maintaining that sort of collegiality, sort of not showing them that you're a prey, you don't know anything and you're out there, because then some of the people will try to get you. And this is where point number 2 comes into play. Show your confidence, even though you're not sure on things, but be confident. Like, you can say, okay, I'm not sure on this, but this can be this. It doesn't matter. It's a provisional diagnosis. It's a diagnosis that's a differential, so you can be absolutely wrong. But as a junior doctor, as long as you can show the basics, that you've done these basics right, then that's important, and that's where the nurses come into play. I can give you one example where, in a particular case, I wasn't sure on what to do. It was something like a pneumonia, and I wasn't sure, and the nurse sort of got the better of me at that time, and that's where I sort of messed up, because I sort of showed to them that I don't know what this is, or I don't know what to do. Like, it's fine, you don't know what to do, but as long as you've done the basics right. So then I started approaching in a way where I would get the basics first and then ask for a second opinion, or what are your thoughts, sort of thing, rather than straight up going to them and saying, oh, what do you think? Don't do that. You do your basics right, you tell the nurse what needs to happen, and then also sort of collaborate with them. So you got to maintain a subtle line where asking them for opinion, asking them for doing a few things for you, but at the same time showing that you also know your basics. All right, but it's always fine that you go and ask them for a second opinion or their thoughts, or some of them are really experienced and really good. So you got to maintain that thing. It's difficult to explain, but I guess as long as you don't show that you're a very weakling and you're somebody who they can step on top of, then you should be fine. Like, you've got to maintain that you're the person, you've done medicine, you know some things, other things you don't know. So yeah, so those were my 3 pearls of advice for you. Make sure you comment and subscribe to my channel for more videos. Let me know your thoughts on what other videos you want, and I'll be more than happy to make some more vlogs. Thank you. Bye.